Hey there, it's Dr. Charles Modlin again, me again, your friendly urologist, for another health equity brief. Remember, these health equity briefs are an opportunity for me, Dr. Charles Modlin, urologist and kidney transplant surgeon, to provide information for you and your family and community that I believe is important for you to remain healthy. And today's topic is going to be hip and joint pain in black men. So, hip and joint pain are prevalent conditions that significantly affect the quality of life for many individuals. Among various populations, black men experience unique health disparities concerning the incidence, causes, and contributing factors, risk factors, and treatment of hip and joint pain. This brief explores these disparities, drawing on relevant data and highlighting the need for targeted interventions in the diagnosis and treatment of hip and bone pain, joint pain in black men. So what's the incidence rates? The prevalence of hip and joint pain varies across racial and ethnic groups according to the Centers for Disease Control, the CDC, and Prevention. Approximately 20% of adults in the United States report experiencing some form of joint pain. Research indicates, however, that black men have higher rates of osteoarthritis, which is a common cause of joint pain. A study published by the Journal of Arthritis Care and Research found that black men were 60% more likely to develop hip and knee osteoarthritis compared to white men. The prevalence of hip pain among black men is approximately 14.8% compared to 9.4% in white men, indicating a significant disparity. What are some of the causes of hip and joint pain? Well, the causes can be multifactorial and include, but not necessarily are limited to, as I mentioned, osteoarthritis, which is the most common cause of joint pain. It's characterized by degeneration of the cartilage in the joints, and black men tend to develop osteoarthritis at an earlier age and with more severe symptoms than their white counterparts. Injuries such as trauma from sports or other activities can lead to hip and joint pain. We all know this. The likelihood of such injuries may be higher in black men due to a higher participation rate in contact sports. We see this in NFL players, professional athletes, etc. Some of the comorbidities can actually contribute to the incidence of hip and joint pain, including conditions such as obesity, diabetes, hypertension, all of which are more prevalent in black men, again, which can exacerbate the joint pain. The prevalence in obesity of black men is around 37% compared to about 32% in white men. Genetic factors can play a role in the development of joint disorders, although more research is needed in this area. Again, risk factors are several. Socioeconomics can play a role. Economic disparities affect access to health care, healthy food options, opportunities for physical activity. We've talked about this in other health equity briefs. Black men are more likely to experience poverty, which can limit their ability to not only obtain health care, but also to even seek preventative care and treatment. Healthcare access, it relates to poverty, economic issues, lack of insurance, transportation issues, mistrust of the healthcare system due to historical injustices, lifestyle factors, sedentary lifestyles, poor diet, limited access to recreational facilities can lead to obesity and subsequently to related joint pain. Black men are more likely to live in neighborhoods and environments with fewer resources for physical activities. Cultural attitudes can play a role. Many men, and especially black men, are macho, stoic. These are some cultural attitudes and beliefs that may contribute to underreporting of pain or reluctance to seek medical help, leading to delayed diagnosis and treatment. So what are some of the treatment options? Effective management of hip and joint pain among black men requires a multifaceted approach, including medications, obviously, non-steroidal anti-inflammatory medications are medications commonly used to relieve pain and inflammation. However, black men may be at a higher risk for certain side effects from these non-steroidals and necessitating careful management. As a kidney transplant surgeon, I'm very much aware of the fact that long-term non-steroidal use can lead to kidney damage, kidney failure, need for kidney transplantation, ulcerations, and some other problems. Corticosteroids are sometimes used to alleviate the pain and discomfort. These may be prescribed for more severe inflammation, but come with potential long-term side effects, potentiation of diabetes, hypertension, obesity, etc. Physical therapy may be a targeted therapy that can improve mobility, strengthen muscles around the joints, and reduce pain. Access to physical therapy services can be limited by socioeconomic factors. Some other ways in which to mitigate are lifestyle modifications, weight management. Encouraging weight loss can significantly reduce stress on the joints, especially in those individuals with obesity. Exercise programs, community-based exercise programs tailored to black men can promote physical activity and improve joint health. Surgical options are usually, in severe cases, like hip or knee replacements, may be necessary. However, studies indicate that black individuals, black patients, are less likely to receive these procedures compared to their white counterparts, often due to socioeconomic barriers and disparities in healthcare access. There are alternative therapies. More research is necessary on some of these alternative therapies, including acupuncture, massage therapy, supplements like glucosamine and chondroitin, although evidence on their effectiveness is mixed. So, in conclusion, hip and joint pain disproportionately affects black men due to a complex interplay of socioeconomic, cultural, and biological factors. Addressing these disparities requires targeted interventions that focus on improving access to healthcare, promoting healthy lifestyles, and providing culturally competent care. So we must increase public awareness through public health campaigns about ways in which to mitigate hip and joint pain, about different treatment options. The educational awareness campaign need to focus on educating black men about hip and joint pain, its risk factors, and available treatment options. As I said, we need to access or enhance access to care. We talked about needing to structure policies that will promote access to care, including improving insurance coverage. We need to develop programs out in the community, to develop community-based programs that promote physical activity, healthy eating, and education about joint health tailored to the needs of black men. We talked about cultural competency, care, so that we can better engage and better communicate with black men. We need to encourage more minority and black participation in research trials so that more specific and effective treatments of hip and joint pain in black men can be discovered. So by addressing these disparities, we can improve the quality of life of black men suffering from hip and joint pain and promote greater health equity in our communities. So this is Dr. Charles Modlin with this Health Equity Brief. Please like, share, subscribe, pass this information along, and I'll see you next time on another Health Equity Brief. And again, I really always appreciate you joining me. My Health Equity Briefs are posted online on LinkedIn, also my Twitter account at Dr. Charles Modlin, and on my Facebook. And you can also go to Spotify and tune in to my podcast called Music, M-U-Z-I-C, and Medicine, where we have a number of archived shows on health equity. See you next time. Thank you.